Hello and welcome to this podcast on diagnosis and management of Targetoid hemosiderotic nevus. Targetoid hemosiderotic nevus is also called traumatized nevus and is characterized by an violaceous ecchymotic halo. It can show an onset at any age, but typically patients refer to a history of physical activities or scratching. The violaceous halo is due to hemorrhage due to trauma. Typically, a nodular pre-existing nevus is seen that shows a sudden color change and a violaceous halo. Dermoscopically, they are characterized mostly by a globular or structureless brown pattern, which are superimposed by structureless red to purple to black areas and a violaceous halo. In this example, we can see a central globular nevus which is surrounded by a purple halo. In the center of the nevus, black to reddish hemorrhagic crusts are seen. Another typical example of a targetoid hemosiderotic nevus, we can see vascular hemorrhagic red to purple to black changes over the nevus. At the left side, we can still see the nevus characterized by a brown pigmentation and some comma-shaped vessels. Another example of a traumatized intradermal nevus characterized by a predominant structureless skin-colored pigmentation and a peripheral red rim. A central hemorrhagic crust is visible. Targetoid hemosiderotic nevi present an exception of the rule to not follow up doubtful nodular lesions. In fact, if history and morphology are compatible with the diagnosis, very short-term follow-up can be performed to reassure the disappearance of the violaceous halo and the turning back of a normal pattern. Here in the left side you see a baseline image of an actively and recently traumatized nevus. Already 2 weeks later the halo disappeared and the nevus shows more a regular globular pattern. In the center the black to reddish structureless area just corresponds to a hemorrhagic crust. Basically, there are 3 different pathways of healing of a traumatized nevus. The first one is restitutio ad integrum, which means that the nevus turns back into its previous and normal pattern. The second one is that a permanent scar will remain, and the third pathway is recurrent pigmentation. Here is an example of a nevus which was scratched, and we see a linear hemorrhagic crust and the purple halo in the nevus at baseline on the left side. 3 weeks after, the nevus turned back to its original appearance and no scar is seen. Instead, here we can see a permanent scar. This was a nevus which had a trauma 1 month before, and at presentation we can see a structureless central white area in the middle of an otherwise globular nevus. This central white area persists for a long time and refers to a permanent scar. Important, a permanent scar should be differentiated from regression. Dermoscopy facilitates the differentiation between a scar and regression due to active immune response. While a scar will present only white areas, regression is usually characterized by diffuse white structureless areas and gray dots as indicated by the arrows. The last pathway is recurrent nevus, and recurrent nevus will be discussed in the next podcast.